Hey everybody, welcome back to Cerebral Happy. If you're looking to understand anxiety disorders better, then you are in the right place. Anxiety disorders are one of the most prevalent mental health disorders affecting millions of people worldwide. They consist of a group of disorders that are characterized by persistent and excessive feelings of worry, unease, and fear. These feelings can interfere with daily activities and significantly reduce a person's quality of life. In this video, we will explore the psychology of anxiety disorders, including their symptoms, causes, and treatment options. I understand that anxiety can be very difficult to deal with, but don't worry because today I'm going to share with you the psychology of anxiety disorders. Part 1. Types of anxiety disorders. There are several types of anxiety disorders, each with their own unique characteristics. These include generalized anxiety disorder. This is a chronic disorder characterized by excessive worry and anxiety about everyday events and activities. Panic disorder. Panic disorder is characterized by sudden and unexpected panic attacks, which can be very debilitating and frightening. Social anxiety disorder. This disorder is characterized by intense fear and avoidance of social situations and interactions. Specific phobia. A specific phobia is an irrational fear of a particular object or situation. Obsessive compulsive disorder, or OCD in short. OCD is characterized by repetitive, intrusive thoughts or obsessions and compulsive behaviors that are meant to reduce anxiety. Post-traumatic stress disorder, or in short, PTSD. PTSD is a disorder that can develop after exposure to a traumatic event. Symptoms may include flashbacks, nightmares, and avoidance behaviors. Part 2. Causes of anxiety disorders. The causes of anxiety disorders are not fully understood, but there are several factors that may contribute to their development. These include genetics. Anxiety disorders may run in families, suggesting a genetic component. Brain chemistry. Imbalances in certain neurotransmitters such as serotonin and dopamine have been associated with anxiety disorders. Environmental factors. Traumatic experiences, stressful life events, and chronic stress can all increase the risk of developing an anxiety disorder. Personality traits. People who are highly sensitive, perfectionistic, or prone to worry may be more likely to develop an anxiety disorder. Part 3. Symptoms of anxiety disorders. The symptoms of anxiety disorders can vary depending on the type of the disorder, but some common symptoms include excessive and persistent worry or fear, restlessness and irritability, sleep disturbances, panic attacks, avoidance behaviors, obsessive thoughts and compulsive behaviors, physical symptoms such as heart palpitations, sweating, and trembling. Part 4. Treatment of anxiety disorders. There are several treatment options available for anxiety disorders, including psychotherapy. Cognitive behavioral therapy, CBT, has been shown to be effective in treating anxiety disorders. It involves identifying and changing negative patterns of thought, as well as behaviors that contribute to anxiety. Medication. Antidepressants and anti-anxiety medications can be effective in reducing the symptoms of anxiety disorders. Lifestyle changes. Practicing relaxation techniques such as yoga and meditation can help reduce stress and anxiety. Regular exercise, healthy eating, and getting enough sleep can also be helpful. Part 5. Coping strategies for anxiety. In addition to professional treatment, there are also several coping strategies that people with anxiety disorders can use to manage their symptoms. These include mindfulness. Practicing mindfulness techniques such as deep breathing and body scans can help reduce anxiety by bringing attention to the present moment. Self-care. Taking care of oneself can help reduce stress and anxiety. This includes eating a healthy diet, getting enough rest, and engagement towards activities that bring relaxation and joy. Support system. Having a support system of family and friends can be helpful in managing anxiety. Talking to someone about feelings and concerns can help reduce anxiety and provide a sense of comfort and support. Avoiding triggers. Identifying triggers that cause anxiety and avoiding them can help reduce the likelihood of experiencing anxiety. Part 6. Stigma and misconceptions about anxiety disorders. Despite the prevalence of anxiety disorders, there are still misconceptions and stigma surrounding these disorders. Some common misconceptions include: anxiety is not a real disorder. This is not true. Anxiety disorders are real and can significantly impact a person's life. People with anxiety disorders are weak. This is also not true. Anxiety disorders are not a sign of weakness or personal failure. Anxiety disorders can be easily overcome. While treatment can be effective, managing anxiety disorders can be a lifelong process. It's important to recognize and challenge these misconceptions to reduce the stigma surrounding anxiety disorders and promote understanding and support for those who experience them. Part 7. Additional treatment options. In addition to psychotherapy, medication, and lifestyle changes, there are several other treatment options that may be helpful for people with anxiety disorders. These include exposure therapy. Exposure therapy is a type of cognitive behavioral therapy that involves gradually exposing a person to the feared object or situation in a safe and controlled environment. Over time, exposure therapy can help reduce the fear and anxiety associated with the object or situation. Eye movement desensitization and reprocessing, EMDR. EMDR is a type of therapy that is often used to treat PTSD. It involves recalling the traumatic event while following the therapist's finger or a light in a side-to-side motion. This can help reduce the intensity of the trauma-related emotions and decrease anxiety. Acceptance and commitment therapy, or in short ACT. ACT is a type of therapy that focuses on accepting negative thoughts and emotions and taking action towards one's values and goals. ACT can be helpful for people with anxiety disorders who struggle with distressing thoughts and feelings. Complementary and alternative medicine. Some people with anxiety disorders find that complementary and alternative medicine, such as acupuncture, massage therapy, and herbal supplements, can be helpful in managing their symptoms. However, it's important to talk to a healthcare professional before trying any new treatment. Part 8. Impact on daily life. Anxiety disorders can significantly impact a person's daily life. They can interfere with work or school, relationships, and everyday activities. People who have anxiety disorders may try to avoid any situations that may increase their anxiety. This can cause social isolation and difficulties in relationships. They may also experience physical symptoms such as headaches, muscle tension, and digestive problems. Part 9. Seeking help. If you think you may have an anxiety disorder, it's important to seek help from a mental health professional. A healthcare provider can provide an accurate diagnosis and recommend appropriate treatment options. It's important to remember that anxiety disorders are treatable, and with proper treatment, most people with anxiety disorders can manage their symptoms and lead fulfilling lives. Part 11. Anxiety and co-occurring disorders. It's not uncommon for people with anxiety disorders to also have other mental health disorders such as depression, substance use disorders, or eating disorders. These co-occurring disorders can complicate treatment and increase the risk of negative outcomes, such as suicide or self-harm. It's important for healthcare professionals to screen for co-occurring disorders and provide comprehensive treatment that addresses all of a person's mental health needs. Part 12. Anxiety in children and adolescents. Anxiety disorders can also affect children and adolescents. In fact, anxiety disorders are one of the most common mental health conditions in young people. Children and adolescents with anxiety disorders may have difficulty participating in school or social activities, and they may also experience physical symptoms such as stomach aches or headaches. Treatment for anxiety disorders in young people may include therapy, medication, and parental support. Part 13. Self-help strategies for anxiety. In addition to professional treatment, there are also several self-help strategies that people with anxiety disorders can use to manage their symptoms. These include practicing relaxation techniques such as deep breathing, progressive muscle relaxation, or yoga. Engaging in physical activity such as walking, running, or swimming to reduce stress and anxiety. Practicing self-compassion and challenging negative self-talk. Setting realistic goals and breaking them down into smaller, manageable steps. Engaging in activities that bring joy and fulfillment, such as spending time with friends, pursuing hobbies, or volunteering. Part 15. The importance of early intervention. Early intervention is critical for the successful treatment of anxiety disorders. The earlier a person receives treatment, the better their chances are for managing their symptoms and preventing the development of co-occurring disorders. It's important for healthcare professionals and parents to recognize the signs and symptoms of anxiety in children and adolescents and provide appropriate treatment as early as possible. Part 16. Anxiety disorders and COVID-19. The COVID-19 pandemic has led to a significant increase in anxiety disorders worldwide. The uncertainty and fear surrounding the pandemic, as well as the social isolation and disruption of daily routines, have contributed to the development or exacerbation of anxiety disorders in many people. It's important for people experiencing anxiety during the pandemic to seek help from a mental health professional and practice self-care strategies to maintain their symptoms. Part 17. Advocacy and awareness. Advocacy and awareness are important for reducing stigma and promoting understanding of anxiety disorders. It's important to recognize that anxiety disorders are not a personal failure or weakness, and that they can impact anyone regardless of age, gender, or background. It's also important to advocate for increased access to mental health treatment and resources, including affordable and accessible therapy, medication, and support services. Part 18. Conclusion. In conclusion, anxiety disorders are a common and often debilitating mental health condition that can significantly impact a person's life. Treatment options include psychotherapy, medication, lifestyle changes, exposure therapy, EMDR, ACT, and complementary and alternative medicine. Early intervention is critical for successful treatment, and self-help strategies and support from family and friends can also be helpful. It's important to recognize the signs and symptoms of anxiety, seek help from a mental health professional, and challenge stigma and misconceptions surrounding anxiety disorders. With proper treatment and support, most people with anxiety disorders can manage their symptoms and lead fulfilling lives. If you're interested in discovering more about psychology and mental health, then be sure to check out my other video at the first link in the description. Subscribe and turn on notifications so you don't miss more videos helping you understand mental health and more. Check out this playlist of my top 10 videos, and I will see you in the next video. Take care.